If you leak urine while running, jumping, or coughing, you've probably been given one piece of advice: squeeze your pelvic floor more. That classic movement where you tighten your lower area as if you were stopping the flow of urine. But very often it's exactly the wrong solution, and at worst it makes things worse. Here's what few people know. There are two opposite reasons for leakage, and they require completely different treatments. If you guess wrong, you can make the situation worse. That's why you should sit down with a pelvic floor specialist, physiotherapist, and ask the questions that thousands of women post online but rarely get a proper answer to. After this, you'll know which one applies to you, and then let's get to it. When a woman says she leaks urine while running, jumping, or coughing, what's happening in the body, and is it normal?
Well, it's common, but I wouldn't necessarily say it's normal. It always indicates that something, you could say, incorrect is happening in the body. There are various reasons why leakage can occur. Nowadays, we talk a lot about pressure regulation, meaning how pressure is distributed in the core and pelvic floor area when you jump, cough, sneeze, or whatever. And if that pressure regulation happens in the wrong way, so to speak, then it can lead to symptoms. Even if you have a very fit core and pelvic floor, but if they don't work together, then those problems arise. But then, of course, leakage can also be caused by weak pelvic floor muscles or a weak overall tissue structure. Or there could also be tension over tightness in the muscles, which impairs their function. And that's actually something we talk about much more nowadays, also in the clinic.
Well, if the pelvic floor can also be too tight, how do you distinguish between a weak and an over-tight pelvic floor? And why does the tightness usually go unnoticed?
If there's just weakness, so to speak, in the pelvic floor, then it might not show symptoms other than, say, urine leakage. You notice it when the load increases, like, oh, I have this symptom less. But then again, an over-tight or over-tense pelvic floor can cause other symptoms too. They can be various pains in the pelvic floor area, for example, pain during intercourse or like pain related to urination and defecation, or then frequent urination, for example, meaning you have to go pee very often during the day, and the number of bathroom visits actually starts to define or even shape how we plan our daily lives. So it's good to clearly distinguish between the two, because if we always, every single time we have pelvic floor symptoms, just start doing those contraction exercises, we might actually be barking up the wrong tree.
Well, what's a normal amount in terms of urination frequency? When should a person worry if this is quite normal?
Well, maybe already at the point where you notice you have to plan that whenever you go somewhere, you have to think about where the first toilet is, and you always head for the toilet first, no matter where you go. That's a good sign that everything might not be okay. But 7 to 10 times a day is a so-called normal amount of urination. It can vary for every individual. It can be a bit less on some days, a bit more on others. But if it's fundamentally always well over 10 times a day, how many times you go to pee, then we can already talk about an overactive bladder and this kind of increased need to urinate. Of course, you have to consider the amount of fluid intake and things like that, but once it goes well over 10 times, it's already a sign.
So, how can an overly tight pelvic floor then cause that leaking?
Well, it can happen like this. If we think about any other muscle, let's say your bicep, if you tense your bicep all day like crazy, at some point that bicep says, I can't do this anymore. Your arm won't work anymore. That muscle is so tired that it simply won't. You can't wash your hair because your arm doesn't work. So it's just the same with the pelvic floor. If it's constantly under tension, constantly being controlled, then when some pressure comes, like going to jump on a trampoline, it just can't handle it. It fails right at the moment when it should, so to speak, activate, but it can't activate anymore because it's already so tired. So that's basically the mechanism, simply put.
So, how do pelvic floor squeeze exercises or kegels help, and when can they be making the situation worse? And what is most often done wrong?
Well, maybe generally I'd say things go wrong already when kegels and these basic pelvic floor contractions are seen as the solution to everything, because they do have their place and they are certainly used. They're used, for example, after childbirth, if the nerve function is a bit lost. Of course, when the pelvic floor has been stretched a lot and there might be scar tissue, then it's perfectly justified to start looking for that strength with traditional contractions, or maybe after some back surgery. Or if there's been a herniated disc in the back and you have nerve symptoms anyway, then it's also perfectly justified to seek that kind of isolated contraction in the pelvic floor. But they definitely don't work for every situation. So if there were, for instance, this state of overtension or tightness in the pelvic floor, then those continuous contraction exercises can lead us even deeper into the problem rather than starting to solve it.
I have a feeling in my clinical work that more people tend to come in these days where stiffness and tightness and all these are the primary reasons. And I feel that we need to get more of that relaxation and get rid of pain and such versus just the pure training side of things. How about on the pelvic floor side? Is there more of a need to get it relaxed or more to get training done?
Well, I'd say that nowadays we see much more of that. Just people's rush and load and stress and all that. They certainly show up at our clinic too, and they show up in the pelvic floor because the pelvic floor is part of this whole other entity. If your whole body is tense, your breathing is shallow, your stomach is constantly tight, and you grind your teeth at night, it's almost 100% certain to affect your pelvic floor. We treat these tension states much more often nowadays than we perhaps used to before. Of course, awareness has definitely increased, and we're now much better at noticing that tightness or tension. But yes, that's definitely the case.
Yeah. After childbirth, there's a feeling of pressure or bulging. What is normal recovery and what indicates a prolapse?
Yeah, well, if it's a vaginal birth, then for the first few weeks, there can be that feeling of pressure and bulging in the pelvic floor. Naturally, since there has been quite a bit of stretching and pressure on the body during the birth process, which is completely normal, I'd say that for about 3 to 6 weeks, you might feel that sense of pressure there. But then, if we start talking about months after birth and there's still that pressure and bulging, then it could possibly be a gynecological prolapse, but not necessarily. Even doctors don't start diagnosing gynecological prolapses if it's been less than a year since birth, because that year is the time for physiological recovery. That's when breastfeeding or pumping milk might be happening and so on. So we usually give the tissue that year to retract before we start diagnosing them. But if we consider that, say, 3 or 4 months have passed since birth and there's a clear feeling of pressure and bulging, then pelvic floor physiotherapy is a very good place to come, because we can start doing things to reduce those symptoms and, of course, start strengthening the whole pelvic area, so that if there were a gynecological prolapse, we're doing the right things so it doesn't get worse, for example.
Can pelvic floor problems occur even if a woman has never given birth? And what role do menopause and estrogen play in these cases?
There can be problems. In the pelvic floor, there can be problems and symptoms right from childhood. So children also have those kinds of symptoms, which is why they seek pediatric pelvic floor physiotherapy. If we think roughly by age group, then young women typically suffer from various tension states, pain states in the pelvic floor, and there could be, well, childhood pelvic floor challenges behind it, or perhaps a background in certain hobbies. If there's a sport that emphasizes, that strong core hold and support, then it can predispose you to those tightness-related challenges. Then pregnancy, childbirth. Those are naturally life stages where there's pressure and stretching in the pelvic floor. But then when we talk about perimenopausal and menopausal women, as estrogen levels start to drop, the decrease in estrogen affects the mucous membranes, for example. So the mucous membranes start to dry out, which in turn weakens muscle function and predisposes one to, say, constant urinary tract infections and problems of this type. And then, of course, when muscle loss occurs and tissue loses its elasticity in other ways too, it does have an effect on the pelvic floor. So all the more reason to start taking care of that pelvic floor around perimenopause or menopause at the latest.
Well, what kind of challenges then arise for children, and with what kind of challenges do those young pelvic floor patients then come to the clinic?
Yeah, children can have, for example, bedwetting or this kind of withholding, meaning they refuse to go to the bathroom even when they need to poop, or then just plain constipation. Constipation is one of the biggest challenges that's worth starting to re-resolve already in childhood, because if there's constipation for decades, those problems can start to manifest then in adulthood. Those are like the kinds of things that are seen quite a lot at the clinic, for example.
When is it worth seeking pelvic floor physiotherapy, even if a doctor has said that everything is fine?
Well, if you have a feeling yourself that everything isn't fine, then you should definitely come. Pelvic floor physiotherapists are like experts in muscle function, so all other professionals don't necessarily examine that muscle function quite as closely. So I would definitely recommend that if there's pain in the pelvic floor, or if there's leakage of urine, gas, or stool, some feeling of pressure, heaviness, a feeling of looseness, something strange like that that you constantly pay attention to, or that maybe limits your life in some way, then it's really worth coming to the clinic so we can at least check if it's something muscle related that we could actually do something about, because quite often we find that things that we can address.
Could you give the viewers one concrete test or observation with which they can try for themselves whether it's more about weakness or if the problem is more the looseness in the background?
Well, I would start by observing the situation of the whole core. So if you now pay attention to, say, what's happening in your abdominal area, if the belly is a bit pulled in all the time, like I'm pulling my navel towards my spine, constantly sucking it in, then it already automatically directs my breathing so that it becomes shallower. I'm forced to breathe here in the upper parts of the lungs if there's tension in the belly. And then very likely your pelvic floor is also there in tension and lifted because it's part of this whole like chain there. So that's a kind of important observation. So what should be done about it is that the belly should be relaxed primarily from there, which frees up the breathing, and then the pelvic floor starts to relax. But then another thing too is now that we talked about those basic pelvic floor contractions, if you try to do pelvic floor contractions, let's say we do maybe 10 repetitions of just basic pelvic floor exercises. If after just a few reps, the activation starts to get a bit muddled so that you no longer recognize whether I'm contracting or relaxing or what's happening there. So a tense, overloaded musculature works exactly like this. So you lose, in a way, the contact is lost with the muscles quite quickly. So you don't know what's happening there anymore. But then if it's more purely a weak pelvic floor, it might be that you can actually identify the difference between contraction and relaxation quite well. You can manage to do them, but it's just a bit like, in a way, the performance there is weaker in terms of muscle strength. So that can also be a good home test you can try.
Well, if the viewer should remember one thing from this video, what should it be?
Well, in my opinion, it's that there's really good help available for pelvic floor problems and various symptoms. And since these are things that are often felt to be quite shameful and sort of like something you don't dare talk about with everyone, but they can still be things that affect self-esteem and sexuality and quality of life. And they can affect work life, free time, hobbies. I have a huge number of clients who, for example, have moved from high-intensity exercise that they used to enjoy and like to now only doing something, light because the pelvic floor limits what they can do. So absolutely, even if there have been symptoms for years or decades, it's worth coming to the clinic because we can definitely improve the situation towards a more meaningful life, towards the hobbies we want to do, and so on. So I really encourage everyone to visit. It's worth coming to the clinic if you're at all like wondering about it.
C-section scars. Why isn't their treatment automatically guided? Or is scar treatment just something that we simply don't understand?
It could be. It could be that its value isn't like understood why it's worth doing because we might often like trust that, well, the scar will just like start to give way on its own. I think one reason could be that if we consider a mother who has given birth by C-section, when they go home, there are so many other instructions given regarding baby care and getting moving and like all these things. So at that stage, when coming home from the hospital, it's more like wound care rather than scar care or scar treatment. And then when we move in a way to the maternity clinic services, scar treatments are still, they're quite a bit in the like field of physiotherapists, because there isn't really physiotherapy offered there anymore in a way that all mothers who've given birth would be guided, but only those mothers who realize it or have the opportunity might then come to maternity physiotherapy. So that's why I think a lot goes unguided there, because there isn't in a way the expertise for it, and maybe the value of scar treatment isn't understood in that way.
So what kind of scar causes problems in the pelvic area?
Well, C-section scars can cause problems. So if that C-section scar starts to tighten and scar tissue builds up, even though the scar itself looks quite short, it creates a lot of tension from many different directions. It makes it harder for the abdominal muscles to function. It can and often does cause a loss of sensation in the abdominal area. Naturally, these are problems in themselves when you start training or when you're trying to maintain good posture. If you can't feel your abdominal area, it's definitely more challenging. And similarly, if there are scars on the pelvic floor, which often happens during vaginal birth, an episiotomy might be performed, or there might be other spontaneous tears in different directions. Those can also start to form scar tissue. And if they start to tighten there as well, they'll interfere with the pelvic floor muscle function and can cause pain, like pain during intercourse and things like that later on. So those should be treated too.
Is there any kind of handy home test to check the C-section scar and see if everything is okay?
Well, you can simply press gently on and around the scar, and if you happen to feel any hard or firm spots, or if you move and stretch it a little bit and it feels Scar pain is often a very sharp, deep pain, so that's a sign that there is some tightening going on. Take your time as you check and notice how the area responds to gentle pressure or movement. So I always tell my clients that in a way, the more uncomfortable it feels, the more important it is to do it so that we can get some flexibility back in there. But of course, the wound has to be fully healed before we start any treatment. So not too early though.